What do you do in a medical emergency? This act is called first aid. First, we're going to be talking about what it is and the objective of first aid. Then we will go over the history of first aid, the equipment and supplies needed, where to find them, and the steps, triage, and times to use first aid. So first, we are going to go over what it is. First aid is the actions taken for people that are suddenly ill or injured in a medical emergency, or it can be as minor as a splinter or a blister. So it started in 1066 with the knights in the British Army because they needed different techniques to save their knights that are being injured. The first aid kit was made by Johnson & Johnson when they needed different materials for minor injuries. So they had items such as wipes and ointment and sterile pads for people to use on the go. So now that you know what it is, the objective, and the history, we're going to go over the equipment and supplies needed. So supplies can range from professional and basic. So basic can be in a small container, which can include wipes, ointment, sterile pads. People can keep this in their car or their house just in case to prevent injuries, or if there is an injury, then they can help the person. It can also be bandages and dressings. So bandages and dressings are used for injuries that, like if you're bleeding or you need pressure on the injury, then you can use it. Antibacterial ointment and the antibiotic ointment are used to prevent infection, which is really important because you can go from a minor to a major injury or illness very fast. The adhesive tape will keep any bandage or dressing on the injury to make sure that there isn't any wiggling. Pain relief medication is used, so if someone gets hit or bruised or they fall, then they can use it so they aren't in as much pain. So it can be ibuprofen, Advil, Tylenol. The hand cleansing wipes and the sterile pads are used. So when someone has like an injury, then you can use it as like doctors use it in their profession, so you don't get an infection because infections can make it even worse. And tweezers. So if someone gets a splinter or another injury that you need to get something out, then you can use tweezers. The professional items are items such as an AED or a CPR mouth guard. So the AED is found in big businesses, schools, hospitals. It's a defibrillator, so if someone needs it, then it's on hand. The mouth guard can be found at an EMS or an ambulance, so you can prevent infection and STDs and infections like between people. The basic items can be found at local pharmacies or places such as Walmart. The more professional items can be found online or places such as like the American Red Cross. Next, we are going to be talking about the steps and triage, since you know what the equipment and supplies you need, what it is, the objective, and the history of it. So the steps are, first, a scene size up. The scene size up is the most important thing to do because it will give you, if the area is safe, the event, and the number of people that are injured. So the people that are going there, so it could be either a bystander or a medical professional, knows who to go to first and if it is safe for them to go. So if it's a car wreck, then they know to go to either this car or that car or someone that's flew out. It also prevents them from getting hurt, so they don't have to have a medical professional come and help them too. The next thing is to see if the person is awake and responsive. So if they're awake and responsive, then you need to get their sample, which is their symptoms, allergies, medications that they use, past events that led up to this injury or illness, and any other information such as other events that could have happened. You also need to provide care according to their injury or illness and obtain their consent before actually helping them, because someone for either religious or other medical issues, they can say no so they aren't given blood or any other type of stuff that they may not want. If they are not responsive, then you can shout at the person to make sure that they aren't just asleep or unconscious. Then if they aren't responding to you shouting, then you need to touch them, touch their toes or their arms so you aren't coming at them so they feel attacked, but you can try to wake them up. And make sure that it's not longer than 5 to 10 seconds, because if they aren't breathing, then you may prevent them from getting help, or you may prolong the injury. If they are breathing, call 911, obtain a sample from people around you, and roll the person onto recovery position, which is their left leg behind their right leg and their arms next to them on their left side. And if they're not breathing, call 911, roll the person upwards, begin CPR and use the AED if you have one, and continue until breathing or EMS arrives. You should never leave someone by themselves, because this can make their injuries worse, or you can get in trouble for leaving them. Triage is the emergencies or medical practices to help organize people. So as the scene size up, you also use this to use tags, so you don't go to someone that's already been pronounced dead or deceased. You know to go to someone that needs immediate care, and then delayed or minor care you can come to in 20 minutes or whenever the immediate people do not need any more help. So the most important things that people use first aid for range from bleeding, blisters, fractures, sprains, bee stings, or even car wrecks, to any other medical emergency that someone can't breathe or they need any type of care. So now that you know all this information about where it originated, what the objective is, the equipment and supplies needed, and the steps and triage of first aid, you will be able to help someone in need when they need something. So you should not be a bystander, and you should be an action taker when someone is in need.